A very big hello and a warm welcome from me, RJ Sulabha. So this is the Fever FM's official page, and here with us, joining me on this conversation today is Dr. Uday Limaye. So what are we going to talk about is a very interesting topic, and it's something which is very, very relevant to each of us. Stroke is an illness that can happen to anybody. And sometimes one feels that there's not enough awareness about this particular disease. And we are going to be asking Dr. Uday a lot of questions regarding that. An honor to have you here with us, Doctor. Hi.
Hi, Sulabha. It's good to be here on Fever FM.
Oh, yes, it's my pleasure as well. And despite your heavy schedule and your, a lot of other things you've given us this time, highly appreciate that. So, giving a little introduction about Dr. Uday Limaye. He's a senior consultant neurointerventionist at Leelavati and PD Hinduja Hospital, Mumbai. Okay, doctor. So here's my first question to you. What is a brain stroke? For those of us who don't understand it absolutely, what is a brain stroke and how severe is the disease?
Okay, so the first thing is that it's very relevant because 29th October is the World Stroke Day. And so this question, what is stroke, is very, very relevant. So generally, when we say stroke, it means there's something which happens suddenly. And the sudden occurrence of something which is necessarily not good is called stroke in English language. Now, people misunderstand stroke for a heart attack, but actually stroke means sudden cessation or sudden stopping of function or part of the function of the brain, which happens without a warning, which may be permanent or which may be transient. So stroke is actually a brain attack, like a heart attack, where heart transiently doesn't receive blood supply or doesn't function as well as it should. When the same thing happens to the brain, we call it stroke, or we call it a brain attack.
When you say it like that, it sounds more scary, It's like a brain attack. But I guess that's the truth. Like, I mean, you've just said it like how it is. So, doctor, tell me, are there any symptoms that one can sort of look for, and even before somebody gets affected by a brain attack? Are there some symptoms?
Yes. So, symptoms of stroke is like, in general terms, everyone knows about paralysis. What is paralysis? Paralysis is the function of the body, any part of your body. It may be your hands, your legs, your speech, your eyes, or your consciousness. Any part of the body, when it stops to function, it leads to symptoms of stroke. So simply speaking, rather than making it very technical and difficult, everything that your body does is actually controlled by brain. So when the brain is not functioning properly, everything that the body does can get affected, and those can cause symptoms. In short, we should remember four things. Number one is that, because we want to make it simple, we always say FAST, F-A-S-T, of which the F starts with face. So face, asymmetry of the face, a drooping of the face. That's the first symptom we should look for. A is for arm. Arm goes with hands and legs both. So sudden dropping of the arm or sudden loss of power in one of the arms, right or left side or right side of the body. Weakness of one side of the body, that's the second symptom. Third is S. S is for speech. So sudden slurring of speech, sudden cessation means you cannot speak. I want to speak, but I can't speak. I don't understand you. Sudden confusion. So speech is the third. That's for the S. And T is for the time. It's not really the symptom, but whenever you see someone at home, outside, in the office, with any symptom of stroke, either he will have weakness on one side of the body, he's holding a cup of tea or a phone, and suddenly he cannot hold it, he will drop it. Suddenly his speech will become mumbled, or he'll appear confused and he cannot actually convey his thoughts. Or it may be asymmetry of the face, drooping of the mouth on one side. All these are the commonest symptoms of stroke. It can also be sudden loss of consciousness or sudden severe giddiness or sudden maybe less vision in one eye or sudden loss of vision in one eye, all those can be symptoms of stroke because eventually they actually lead to the brain.
Right, but many of the symptoms that you've said now we can sort of also get misled, right? Sometimes even if there's like a low BP or a low sugar, people could get confused, right? But like you're saying, it doesn't hurt to sort of strike that off the list because this is a problem because we're talking about how severe could it be, doctor, when one of these symptoms manifest?
Yeah. So when any of these symptoms manifest, even if they are because of low blood pressure or low sugar, they manifest through the brain.
Okay.
Brain functioning properly, brain requires blood supply, brain requires oxygen. Simple. So when there is less blood pressure, the pressure of the bloods being supplied to the brain is less, so brain functions lesser. If there is less sugar, obviously less amount of nutrients reach the brain, and because of which there is maybe transiently a little bit suboptimal functioning of the brain. So when we say that it is because of low BP or because of low sugar, actually it is through the brain itself. Low BP by itself, just the heart itself cannot give all these symptoms. Okay, so if you have history of diabetes or blood pressure, and that person has these symptoms, the first thing to do easily is rather than push the panic button, try and correct these two. How
Okay.
do we correct these two at home? One, you give the person something sweet, sugar, or some a lime juice with sugar and salt, so that his sugar comes up. With salt, his blood pressure can come up. Let him sit or lie down. So maybe less blood supply becomes a little more blood supply because the head right now is the highest portion of a body. Once we lie down, it gets more blood supply. So these two things you can do right away to rule out whether it is because of diabetes or because of low BP. If, in spite of doing that, the person continues to have the symptoms, for God's sake, do not wait for minutes and hours together. Because, see, our first reaction is, oh, let me just lie down, or let me just sleep for some time and you'll be all right in half an hour. It may not happen because if it is stroke, then it will just progress. So do the simple things first. Do not press the panic button on minute one. Do the simple things like sugar, the blood pressure, and if he's still symptomatic or the symptoms become worse, then we have to absolutely press the panic button and rush to the hospital.
Right, because that brings me to the next very important question, Doctor. Time, right? You were just talking about how important it is, and they call it like the golden hour or something. You call it that, right? So tell us about that, especially in case of a stroke. Why is it very important that the patient gets emergency care as soon as he can?
Okay, so the golden hour is, I'm giving you simile with the heart. The golden hour to the heart is because if you can restore the supply to the heart can function normally, and the heart that goes away, person makes a recovery. Same thing goes with the brain. With the brain, golden hour is a loosely used term. Actually, it means that as soon as possible, the brain has to start functioning. Now, every stroke is not because of blood supply cut off to the brain. There are two types of stroke. One could be because of brain hemorrhage, so that has a different management altogether. Today, we are not going to talk about that. Today, we are going to talk about something which is completely reversible, and that happens because the brain receives less or no blood supply transiently or permanently. So when that happens, if it is restored and restored as soon as possible, the brain can recover very fast. Every minute, every second that you wait or there is delay, millions of neurons die. In the brain, when there are brain cells and brain tissue, it consists of neuron. That's the basic cell of the brain. If it doesn't receive blood supply, it doesn't receive oxygen, it doesn't receive nutrients, it's an extremely vulnerable tissue which dies. Millions die in a minute. And so what could be reversible? What could be full recovery? If you wait too long, then it is too late, because once those cells die, and when millions of cells die, we cannot do anything about it. It becomes a permanent deficit because that part of the brain which has died it cannot recover. We have to restore blood supply at the fastest. That's why it is like an emergency. We must treat stroke as an emergency. So that's where the time is important. Don't waste time. Please rush him to the hospital if it is stroke. And another thing, please rush him to the hospital which is capable of treating stroke. So either we can talk now or we can talk when we discuss about treatment of the stroke in the next question or something.
Options, yes, doctor. So that brings me on to... Okay. So yes, that brings me on to the next question. Can strokes be prevented? If so, how?
See, we are in medical profession. Okay, medical profession, why are we doctors? We treat bodies. Something goes wrong, and doctor, can you treat me by operation? Can you treat me by medicines? So something going wrong, if we can prevent it, then we can prevent all the sequels which happen because of something going wrong, like disease. Stroke is an emergency. How? There are two ways of treating stroke. One thing is, if we can avoid getting a stroke, that's the best. So prevention of stroke is what it is. And secondly, unfortunately, if it happens, then how do we treat stroke? Okay. So in prevention, we must know to prevent stroke, there are certain factors which cause stroke or which cause cessation, loss of blood supply, plaques in the brain. And those risk factors are, number one, we already talked about hypertension. Number two, it is diabetes. Number three, it is smoking. 1, 2, and 3 are the biggest killers, whether it is heart or it's the brain. Apart from these three, high cholesterol, obesity, sedentary lifestyle, and generally aging process, all these are risk factors for the stroke, of which aging is inevitable. The other 5 factors are preventable risk factors. Control blood pressure with medicines. Control diabetes, sugar. If you get diabetes, control it as much as possible. Never smoke in life. If that is not possible, if you smoke, quit smoking. Smoking is one controllable factor. It's in your hands. If you quit smoking, that's the third thing you can do. Obesity, sedentary, start moving a little. Walk, a little jog, a little cycling, very light exercise. It goes a long way, because these are risk factors for a reason. They can go on for decades together in your body. But if you want to do something about it, it's never too late. That's how you prevent the stroke or the brain attacks.
Right. So coming to the next part of your solution, you said you can either prevent it or you can treat it. So do tell us, what are the options that are available for treatment of stroke, doctor?
Stroke can be very, very severe, because we all know that there is paralysis and that person may be bedridden for life or dependent for life. Unfortunately, is useless to the society for his family. So we want to prevent that. That's our aim and motto. That's the goal. If stroke happens, then how can we make the person normal again, so that he can be mobile, he can do what he's supposed to do for his society, for his family, for his job, whatever. So how to treat stroke? I'm talking about the strokes which are because of less or no blood supply to part of the brain. So we have to restore the blood supply. There are 2 ways of restoring. Number one, the blood supply is cut because there is a small little clot which forms inside a small blood vessel of the brain. Either we can dissolve the clot or we can remove the clot out. So there are 2 ways of treating stroke. One is an injection which is given through the arm, and that injection goes everywhere and circulates in the body. Of course, it reaches the brain and it reaches where the artery is blocked. This is called as lysis, thrombolysis. We actually dissolve the clot and the blood supply is restored. Some clots, not all clots are really amenable to this. Some clots are stubborn. They do not, then nothing just happens because of lysis. Those clots need to be actually physically taken out. So we have a few devices by which we go into the brain, into the blood supply of the brain. We identify which artery is, which blood vessel is blocked, and physically, mechanically, we remove the clot. It is mechanical, it's MT, mechanical thrombectomy or mechanical thromboaspiration. Forget about the medical aspects of it. MT is the short form for the mechanical removal of the clot. The first thing is thrombolysis. Second thing is mechanical thromboaspiration or thrombectomy, which is MT. These are the two ways by which we can restore blood supply. If we do it early enough, like magic, the brain function restores, recovers, the patient recovers and can walk home the next day or the day after that.
Right. So stroke is treatable, right? Even so, whatever depends on the degree of damage, they can get back to being normal. Doctor?
Yes.
Okay.
So see, everything, this is not like a magic wand. So sometimes strokes which are treated early enough, treated well, 80% of them, we are able to restore the blood supply. And a huge percentages, means 2 out of 3 patients will recover fully. These are not bad percentages at all. In medicine, stroke treatment is one of the most effective treatment that we know over decades together. Why? Is because once we restore the blood supply, and if we do it early enough, the brain is not damaged too much. The brain starts to function as if nothing has happened. And so 2 out of 3 stroke patients can do full recovery. 80% of blocked arteries can be actually open. So these are good percentages. It's a good treatment.
Okay. So one message that you would like to give people, because it is on the 29th of October, it is the World Stroke Day. What would you like to tell people?
Yes, that one message I would like to divide into A, B, and C. I'm sorry. So the first part is that try to prevent it. Healthy lifestyle, the things which I talked about, try to prevent it so that you don't suffer from a stroke. Unfortunately, if stroke happens, it's not hopeless. Don't give up. Stroke is treatable. Rush the patient to a hospital which is stroke ready. It has to be a big hospital. And third thing, you go to a stroke ready hospital, we also have to be ready because all these newer part of medicines, the advances, unfortunately cost. There's a cost which is involved. So whatever, whenever possible, get yourself insured. It is not possible to spend big amount of money in emergency suddenly. It may happen middle of the night or in the morning. So the third thing is get yourself insured so that when you go to the hospital, you know that you're financially secure for all these new advances. That's my message.
Thank you so much. I think that was very helpful, the way you spoke about fast, on how we have to look out for the symptoms, whether it's our face or the arms or slurring of speech. That was, I think, very for us to remember. I think that was nice. Okay, and yes, the final message that you spoke about, insurance. India is a country where a lot of us still haven't realized the importance of it. And like you very rightly highlighted, I hope we take that seriously. Thank you so much for being a part of this, Doctor. Good day to you.
Yes, thank you. You too. Thanks a lot. Bye-bye.